Right, our next speaker is Nathan Oswin. Hopefully, I've pronounced that correctly, and he's the TUC lead for the COVID inquiry. So I think we'll certainly be interested to hear what Nathan has to say.
Cheers. Thanks, Mary, and thanks for the invite to speak to you all today. First, a bad habit of language that comes with working with the inquiry. If you hear me saying during the pandemic, I'm actually talking about the period under investigation by the inquiry and not suggesting the pandemic's over. But unfortunately, it's a bad habit I have of slipping into that language when I'm talking about it. So apologies in advance. So the COVID-19 public inquiry serves sort of three key purposes that are worth understanding first before talking about the TUC's aims. One, to establish fact, i.e. what happened during the inquiry. And there's a good example of that for how it started for the Module 1 report, which is out earlier, where it sort of says, public services, particularly health and social care, were running close to, if not beyond capacity in normal times. Something that I doubt comes as a shock to any of us, but comes as a bit of a shock to the system at times when it's sort of hard written down following a significant report. But that's important because it then frames the rest of the inquiry and the investigatory routes that it takes. Two, establish accountability. Well, we've not seen quite how the inquiry's done with that yet, because the main module that deals with will be the next report, probably due spring next year, which was the one when you saw Boris Johnson on the stand, Matt Hancock on the stand, Rishi Sunak on the stand being grilled by lawyers into government decision making. And then for the purposes of this speak in particular, the third and arguably the most important role of an inquiry is to make recommendations so that the lessons are learnt and that policymakers are under pressure to rectify challenges in advance of any future crisis. One of the things that's happening at the inquiry that sort of frames what outcomes people want is what the chair views your expertise as. So there's a lot of what are known as core participants across the inquiry. And the chair, Baroness Hallett, very much has her, oh, you lot are very good and very smart on X, but I don't think you're experts in Y. And so we've all sort of ended up framing our wants into where we think the most likely outcomes are. And another note of acknowledgement in advance, all our priorities I'm not going to be able to list within 5 hours, let alone 5 minutes. So this is very much a whistle-stop tour, but I think you can sort of break our main ones down into a few key areas. One, financial support. So as colleagues will be aware, one of the big challenges of the pandemic actually was a real lack of financial support for workers, particularly in precarious employment situations, to be supported to self-isolate. So you had social care workers, for example, who suspected they had COVID-19, worried about taking a test because then they'd need to stay off because they couldn't get financial support to self-isolate, which meant they couldn't feed their families. Now, that's an impossible choice for any worker to have to face. The state should have been providing an instant uplift, sorting statutory sick pay out, which is a mess in this country and one of our biggest priorities to hopefully rectify via the inquiry route to challenge that. The second, and where we think the chair views us as experts, and certainly given some of the speeches, you'll be glad to hear this, the HSE, the health and safety regulator in this country that effectively just saw a pandemic and went, it's nothing to do with us, is it? We can just walk this way. And I think at best I've described it as occasionally popping its head round the door, yelling, is everything okay? And then walking off before anyone had the chance to answer. And if there's one, for those of you in the health and safety world, go and watch their evidence that they gave in Module 3 a couple of weeks back. It's staggering, the lack of tone and recognition and accountability that they had there. So we really hope to make some recommendations around that. Framing that, as Marie and others spoke about earlier, is the equality strand. You cannot change the system without understanding the amount of inequalities within it and framing all of that work across there. 4, social partnership. one of the things we think happened is that in systems such as the NHS, where you have a built-in structure for unions to engage and negotiate with employers and government and delivery bodies, the impacts were mitigated against somewhat. Something like social care, where there's no structure, it's just in an absolute shell. It was far harder. There's no central body to have that interface between workers, workforce representatives, and the state and the employer and push through. 5, and these are the more holistic bits, I suppose. 1, working people's experiences on the record. I don't know if anyone managed to catch Professor Fong's evidence the other day, which was deeply moving. But having those experiences, and not just people like Professor Fong who are experts, but the direct lived experience of workers who were tackling the pandemic, the consequences they faced through lack of government action, lack of health and safety regulation, lack of statutory sick pay, is really important. You know, it's a marked moment in our history that working people's voices need to be heard loud and clear and entered into the record. And then the other point is, so people like Mary, people like Janet, people like Joe, people like Jonathan, who were battling expressing our values into workplaces and trying to tackle the pandemic. I sort of long argued, I think the pandemic period in question is a real good example of our movement putting its values out there and sort of making a difference and trying its hardest. We should be proud of that. You know, we should be standing up and saying, this is what the difference of organised labour and people coming together to try and tackle society's problems are. That we do make a difference, that the actions of people did genuinely go and save people's lives. And yet part of the difference between us and the state is the state has a sort of slight acceptability of death, you know, and challenge. We don't. You know, you fight for every life, and that's why, you know, that slogan around Workers' Memorial Day, remember the dead, fight like hell for the living, is about every individual and not a wider piece. So that's a whistle-stop tour, Marie. I reckon I'm about up to my 5 minutes, and I don't want to get told off, which I'm very used to had happened to me, but I'm trying to avoid today.